Half of WRAL or Capital Broadcasting Company.
It's time for answers to your medical questions. And get an inside look at the latest in healthcare, medical technology, and treatments. This is Rex on Call.
So basically my heart rate would just go up to like over 200. I won't be able to sit down or stand up. I would just need to lay down.
Heart disease affects all ages, all races, men and women, and today we want to help you answer your questions on how to keep your heart healthy. Good afternoon and welcome to Rex on Call Live on WRAL. I'm Kim Dean Holderness for Rex Healthcare. Heart disease is the #1 killer among men and women. It affects those in all ages of life, which is why many miss those early warning signs. Today, our experts will be answering your questions on how to reduce your risk of heart disease. If you're watching us live now and have questions concerning heart health, our operators are standing by to take your calls. Your questions may be answered here live on our program by our experts. Those experts answering your questions today are cardiologist Dr. Pacemaker, the director of electrophysiology at UNC, and Dr. William Newman with Wake Heart and Vascular. To call us here at Rex on Call, just dial that number on your screen. In Wake County, 919-744-3876, and outside of Wake County, toll free 877-277-6252. If you're watching us as we're streaming live on WRAL.com, you can email us a question to rexoncall at rexhealth.com. You can even find us on Twitter. Send us a message at rexoncall, hashtag rexhealthcare, hashtag rexoncall. I promise I'm going to get it right. Cardiac electrophysiology is the practice of diagnosing and treating the diseases triggered by faulty electrical workings of the heart. We want to introduce you to a woman who doesn't look like your average heart patient. She's always the youngest person in her cardiologist's office, but after repeat visits to physicians, she says her rare heart condition was diagnosed by Dr. Sami Mubarak with Rex Heart and Vascular Specialist.
Rania Samara may not look like your typical heart patient, but this 22-year-old high school math teacher had been going to doctors for years to diagnose sudden rapid heart rate.
So basically my heart rate would just go up to like over 200. I won't be able to sit down or stand up. I would just need to lay down.
These attacks could come without warning. Not ideal for this first-year teacher. No one could diagnose the problem until she found Dr. Mubarak.
I heard about Dr. Mubarak and how he does great things, so I called his office and I told them what was going on. They did an EKG and saw that my heart rate was up to a 240, so they wanted to do the catheter ablation.
Rania was suffering from supraventricular tachycardia, or SVT.
It starts suddenly, it stops suddenly, it goes very fast, quickly from normal heartbeat, 60 to 100, to right into 180, 200 within one beat.
Dr. Mubarak used the catheter ablation procedure to regulate Rania's heart rate for good. Here at the electrophysiology lab at Rex Hospital, they're using the state-of-the-art technology to tackle heart rhythm problems that have plagued our population, like the irregular heart patterns of atrial fibrillation.
One of the epidemics in cardiology is atrial fibrillation, which is the most common abnormal rhythm in human beings, especially after the age of 60. And because of our aging population, we are seeing more and more people with atrial fibrillation.
And in this lab, they can map out the patient's heart.
By putting this on the screen in front of us during the ablation, we know exactly where the catheter should go in relationship to these pulmonary veins or the left atrium, and we know definitively where to ablate.
Using similar mapping techniques, Rania's heart issues were finally diagnosed and cured.
He did an amazing job. Everything went smoothly. The people here were awesome, had no problems, so it was very easy, very fast. I just couldn't believe it took that long to do this.
And joining us now are cardiologist Dr. Pacemaker, Director of Electrophysiology at UNC, and for Heart and Vascular Care, and Dr. William Newman with Wake Heart and Vascular. We are already getting a lot of questions in, so let's get right to it. Now, talk to us with these new techniques. How are you able to treat things like AFib?
I think, as Dr. Mubarak explained, atrial fibrillation is the commonest arrhythmia that we encounter, and the majority of patients are going to be managed with medication, but an increasingly significant minority of patients fail medications and come to us for surgical procedures. And the kinds of surgical procedures that we do are surgical procedures done through catheters introduced into the veins at the top of the legs up into the heart, and we can then move our catheters around inside the heart and find the short circuits that cause the atrial fibrillation. But as we need to move the catheters in three-dimensional space, the kind of three-dimensional images of the heart that Dr. Mubarak showed in the introductory segment are absolutely crucial for us to know where we need to burn inside the heart. Because if you think about it, an X-ray just gives us a two-dimensional image, whereas the heart is a three-dimensional structure. So all of our patients have CT scans or MRI scans done, and we can then extract their real cardiac chambers out and use them in virtual reality, a little bit like a computer game, actually.
It's quite a sophisticated computer game. And we have another question, as does taking hormone replacement therapy have an effect on heart disease? That one's for you, Dr.
Yes, the management of hormone replacement therapy in women obviously has received a lot of attention over the years, and it's not always been uniform. And but we now know that through observational studies that there's only one category that hormone replacement therapy helps in postmenopausal women, and that's osteoporosis or hip fractures. It has a negative impact on a person's chance of having clots in the legs or in the lung or heart disease or stroke. So if a woman thinks she needs help with relief of symptoms, the current recommendation is to follow up with her medical provider for two reasons: to identify the lowest dose for the shortest period of time.
Okay, so it's not something to stay on for the rest of your life.
No. The evidence is overwhelming that it has a negative impact on a person's chance of having heart disease and strokes.
Okay, and this question actually came from email from my grandmother, and she has a pacemaker, and she's concerned about exercising, and she wants to know what should her highest heart rate be when she's walking on the treadmill. How does she figure that out?
That's such a good question. Patients whose heart rates are abnormally slow are frequently treated with pacemakers, and the pacemaker can adjust the level of your heart rate according to your activity. And the way they do that is they sense how much movement there is in the body. So the more the body sways, so the more heart rate you get. The more you breathe, the faster you breathe, the more heart rate you get. Your grandmother's cardiologist knows what the upper limit that he or she has set the pacemaker to be, and she needs to ask her cardiologist what the upper limit of the pacemaker is. And then if she's not getting there with exercise, then he can adjust the pacemaker so that she will get there. She can change the sensitivity of the pacemaker to exercise. It's a significant problem among patients with pacemakers that they don't reach the target heart rate that their doctor has set for them because the sensors in the pacemaker that sense respiration and mobility have not been set sensitively enough, and it's so easy to change that with the programmer through the skin. It's like the act of 2 or 3 minutes in the office.
Okay, so Mima has to make a phone call over to her cardiologist.
Yes,
Okay, we are going to be back after the break to answer your questions. Our operators are very busy already taking those questions for our experts. In Wake County, call us 919-744-3876. Outside of Wake County, toll free 877-277-6252. Email us your questions to rexoncall@rexhealth.com. We'll be right back. Welcome back. This is Rex on Call live on WRAL. Today we're focusing on keeping your heart healthy. If you have questions, just dial those numbers that were just on your screen. There they are right now. We have a stack of questions. Let's get to them. This is from Betsy in Goldsboro. She has chest pain. She wants to know how and when to go to the hospital.
That's a good question. I think a lot of it depends on what risk factors we have. For instance, if you have a young woman in her 30s and she's having chest pain and she has no risk factors at all, it may be a situation where she simply makes an appointment with her doctor to follow up for evaluation of those symptoms. If, on the other hand, you have a 65 or 70-year-old gentleman who smokes 2 packs a day and has high blood pressure and diabetes and has tightness in the chest and breaking out in a sweat, this is a situation where he should probably take an aspirin and then seek medical attention.
And get to the hospital and probably not drive themselves there,
That's
I would imagine.
correct.
Yeah, don't
That's
drive
correct.
there. This is from Julia. She's 24 years old. What does a heart monitor exactly do? She has a skipping heartbeat after stair walking. And there was another similar question from Susan. What does it mean to have heart fluttering mostly at night?
A heart monitor is something that we use to diagnose arrhythmias of the heart. They come in many and various forms. They can simply be something that sticks to your chest like a big blue Band-Aid, or sometimes they're a bit like a pager on your belt with wires attached to your heart. And what they do is they record every beat your heart does, and sometimes they record only when you're having symptoms, in which case you press a button. But what it gives the physician is an electrocardiograph to look at and know whether you have an arrhythmia. Remember, it's not normal to have a regular pulse. Everybody has an irregular pulse. Everybody's heart skips a beat from time to time, and people often notice it at night or when things are quiet, when they're relaxing and reading a book or something like that, because there's really nothing else to think about. That's not to say that everybody who has fluttering of the heart at night or when they're relaxed and quiet is completely normal. And if it's happening a lot, you should consult your physician, and he or she may well put a heart monitor on you to know if it is an arrhythmia or not. But remember, you should go into that with an open mind. It may be normal, it may be an arrhythmia.
And adding to Dr. Mounsey, it's, very few people know that their heart actually beats over 100,000 times every day, and for it to not skip a few beats is unheard of.
Okay.
So everybody's heart skips beats.
Okay.
Some are important, some are not.
Okay. This question came in online. How important is the BNP level in diagnosing congestive heart failure?
That's a good question. BNP is the abbreviation of B-natriuretic peptide. It's a blood test that we can measure. And for instance, if somebody has shortness of breath and they also have lung disease, it's a fairly good way of separating the two causes, or separating the cause of shortness of breath out. The higher the number, the worse the heart failure, if you will. And it's also a reasonably good way to monitor the degree of heart failure as an outpatient.
Okay. This question we'll try to get to real quick. I'm from Raleigh. What's the criteria for a pacemaker?
That's a big question, but real quick, if you have a slow pulse that's associated with symptoms of dizziness or blackouts, that would be an indication for a pacemaker.
Okay, and defibrillator?
A defibrillator is a device that prevents sudden cardiac death, and patients with heart disease need defibrillators. So if the heart is weak, for example, if you've had a heart attack, or if you have what we call a cardiomyopathy, which is a weak heart for no particularly good reason, if the heart gets to a level of weakness, the incidence of the risk of sudden cardiac death, of cardiac arrest in simple terms, starts to rise. Unfortunately, most people who have a cardiac arrest don't survive it. So we try to implant a defibrillator before it happens, such that if you have a cardiac arrest, the defibrillator is already there to take care of it.
Okay. And we're going to go to Rex Hospital. Okay, Rex Hospital has been marking this month Heart Month with contests and giveaways to help bring awareness to the treatment of heart disease. Check out rexhealth.com/heart-month for all events like the Pumped Up Facebook contest and Twitter contest. Rex has teamed up with the Carolina Hurricanes, looking for great stories about what gets you pumped up. Share your story about your journey to good health on the Rex Pumped Up Facebook page, and you could win the ultimate fan experience, including VIP tickets, dinner to a game, meet and greet with the players, all that great stuff. And you can be tweeting from a game to get, during the broadcast, you'll be asked to tweet using hashtag RexOnCall for Rex Heart for a chance to win some great prizes. We are going to be right back to answer all these questions that are coming in. Thanks for joining us. We'll be right back. Welcome back to Rex on Call here live on WRAL. We have a stack of questions we're going to get through. If you have any questions, you can call those numbers right on your screen. Okay, Lewis from Rocky Mount saying, what can he do to lose weight? He has AFib, and somebody, Tom from Raleigh, also called in about AFib. He was recently diagnosed with AFib. Can this be corrected?
Okay. The AFib can certainly be corrected. What he needs is a thorough investigation, a series of investigations by a cardiologist, and if appropriate, referral to a cardiac electrophysiologist. As I mentioned earlier, we can often make atrial fibrillation go away with medications, but if we can't, there are a variety of corrective operations that we can do, usually through instruments, sometimes actually through the chest wall, or some combination of the two. And in the vast majority of patients, we can actually make atrial fibrillation go away. It's what we cardiac electrophysiologists spend most of our time doing. To take the gentleman who has problems with obesity and atrial fibrillation, it is a particularly difficult collection of problems, because to get rid of the obesity, you need to eat less and exercise. It's difficult to exercise with atrial fibrillation. So I quite frequently get sent people who have atrial fibrillation and want to lose weight and are crippled with palpitations and breathlessness when they try to exercise, and they just can't do it. So I correct the atrial fibrillation, and then that allows them to address their overall health issues.
And we are getting some lifestyle questions, and tell me, how does that really affect the heart?
Obviously, being overweight and obese is a very common problem in this country. Roughly 70% of adults are overweight or obese, and believe it or not, roughly 1 out of 5 adolescents are overweight. And of those kids or adolescents who are overweight, roughly half of those already have cholesterol problems. The problem with obesity is, once we reach the category of obesity, we increase our risk of having heart disease and dying of an infarct by 5-fold. And what I would encourage the listeners to do is to go online and to look at what is termed BMI calculator, body mass index calculator. Sometimes going to the doctor, it's an awkward situation. And what is my goal? What is my weight goal? And it can create a little awkwardness. But by looking at this online, you can see what your goal is, and try to maybe decrease caloric intake and increase activity to lose weight.
Okay, here's a question from Julia. Can she take a green tea diet coffee supplement that Dr. Oz has endorsed? What do you think, guys?
Well, bottom line is, I don't know.
Let's add something that was on the bottom here. She has cardiomyopathy and a left ventricle ejection disorder.
You know, a lot of these over-the-counter products will have caffeine. Dr. Mounsey can address that with a cardiomyopathy, but we have to be careful with some of the over-the-counter medicines and drinks and so forth that we take. We need to know what we're consuming.
Okay.
I would completely endorse that. And somebody who has a heart that's not beating as strongly as it should be, which is what a cardiomyopathy means, I would be very careful about dietary supplements in general. A lot of them have caffeine or caffeine-like compounds in them, and they are certainly associated with rhythm disturbances of the heart, extra beats, and even with atrial arrhythmias, atrial fibrillation.
So she should probably stay away from that.
I think she should at least take the supplement to her doctor and let her doctor have a look through what's actually in it.
Okay, great. We're going to have a final round of questions right after this break. This is Rex on Call. Welcome back to the show. This is Rex on Call. We're taking a final round of your questions, and we are getting so many questions today, but that speaks to the need. You're going to tell us a little bit about new efforts at Rex,
Well, actually the combined efforts of UNC and Rex together, it's a great vision looking ahead of combining actually two groups of cardiologists who really generally are not seen to be working together on a day-to-day basis. And that's a large cardiology clinical private practice and the teaching staff like Dr. Mounsey at UNC. The goal here is to blend these two cardiology groups together and to work in a new facility at Rex, 115-bed heart hospital, not a heart center. There are heart centers all over the state.
Hospital.
That's right. But this is a heart hospital. I think it will serve as a model for others to evaluate and try to. That's exactly right. But it's a great idea for patients.
Absolutely. Okay, and there appears to be some need here because Harriet, calling from Durham, if you have a stroke, could it cause heart problems?
I don't think strokes particularly cause heart problems, but atrial fibrillation can certainly cause stroke. One of the great scourges of our time is the way that blood clots develop in the heart of patients with atrial fibrillation, and they can break off, go up to the brain and cause a stroke, which is why so many of our atrial fibrillation patients are actually taking blood thinning medications to make that stop happening.
Okay, this is a question from online. I have a pacemaker. I'm 63 years old. Is that considered heart disease?
Well, I mean, in order to have a pacemaker, something has to be malfunctioning about your heart. The electrical system of the heart has to be malfunctioning. But the issue is that you don't have to have blocked coronary arteries or a weak heart to need a pacemaker. The electrical system of the heart can wear out before the rest of the heart does, in which case we simply rewire the heart to put in a pacemaker. So somebody with a pacemaker doesn't need to necessarily have heart disease in the conventionally accepted sense of blocked arteries, a heart attack, or a cardiomyopathy.
Okay, this is Perlene Parrish, having symptoms of chest pain, squeezing. When she goes to the doctor, they tell her nothing's wrong.
Well, here again, I think on a visit to the doctor, what you try to do is try to risk stratify these people into low, intermediate, and high risk categories. It may be that she could be having other symptoms and heart problem, but I think
because so many are over. We actually got a question also, the difference between a panic attack symptom versus a heart attack, because the symptoms are very similar. How do you tell the difference?
I think the issue is that if you have discomfort here, it could be caused by something coming from your heart. It could be caused by, for example, an adrenaline surge causing the heart to race, causing you to be sweaty. It could be coming, for example, from spasm in your food pipe. We have ways from the esophagus, we have ways of differentiating these things, and there are certainly tests that cardiologists and general physicians can do to make sure that you're not at risk of having a heart attack from these symptoms.
Yeah, and I think in women especially, because the symptoms can be so different. What's your recommendation? Should they go see their doctor if they're confused about what it is, heart or anxiety?
Well, absolutely. Heart disease in women is a real problem. 1 out of 3 women who died last year died of heart disease, whereas 1 of 30 died of breast cancer. For reasons not really known, I think women present with different symptoms. I think the most unusual presentation I've seen for a woman was that she hurt in her left thumb only. But she had heart disease, and that was a tough one to pick up on.
And don't you think that there's been so many PSAs, there's so many women out there that just simply ignore that because they write it off as anxiety?
Yeah, well, we normally think of women of not having heart disease. When we think of heart disease, we think of a man.
Yeah.
And maybe we all need to process our thinking some.
And there was a question that came in. Grandmother passed away from congenital heart failure at age 52. Her father had heart disease and had to have a bypass at age 52. She's 35. At what point should she be screened?
I think somebody like that, who, with that degree of family history of heart disease, should do the simple things well, should have an ideal body weight, should have a body mass index of 25 or less, should never ever smoke cigarettes, should eat a heart healthy diet at all times. And I think for somebody like that, it's important to know what her cholesterol is and to treat that appropriately.
I think very quickly also, as a patient, when we as patients visit our doctor, we need to come away from there with certain knowledge. We need to engage. We need to know what our BMI is. If we have a family member with diabetes, we should know what the A1C is. We need to know our blood pressure and cholesterol.
Okay, great information. Thank you so much for being here. And as always, ask your physician about any health concerns. Thank you very much to our experts in our phone bank. They are still very busy taking calls. Join us next month for Rex on Call. Our topic will be colon health. That's March 18th at 1 p.m. You can email your colon-related questions ahead of time using rexoncall@rexhealth.com. We will see you next time. Thank you so much for joining us.
This has been a paid commercial program. Views expressed belong to its participants and are not necessarily those of the